The World Health Organization has pledged to provide Zambia with 1 million doses of cholera vaccines. The agency says vaccines will help control the outbreak. The Southern African nation requires about 7 million doses of cholera vaccines. It's been battling an outbreak of the waterborne disease, and the capital, Lusaka, hit the hardest. At the same time, the Zambian government says schools will remain closed for another 3 weeks. For more on this conversation, we're now joined by Zambian journalist Arthur Davies at Sikopo. Arthur, appreciate your time this evening. Would you provide an overview for us of the current status of the cholera outbreak in Zambia?
Thank you so much for having me, Hugo, and great to be here. So we are having, just like you have rightly put it, we are having a crisis of cholera in the country, and as of today, we are running at 179 deaths that have been recorded since it's a major outbreak in October last year, just some 2 months ago. So as of today, we are running at 179 deaths of people that have died. And of course, people continue to be admitted daily. And of course, just within 24 hours, we have lost 20 people that have died out of cholera. And the other day, we lost 23 people, which is a very huge number. And the numbers, I think, just starting from the 1st of January, have been increasing. We're running somewhere around maybe about 5 deaths in a day, but it escalated to 20, 23 that we got, which was the highest. And we're now getting down to, we're now at 20 as of in the last 24 hours. So the cholera situation in the country is quite critical. And of course, we've seen donors coming in, pledging what they can pledge. Yesterday, we saw UNICEF coming in and just providing ORS or donating ORS to the Ministry of Health in the country. So we are having this particular crisis. And of course, it is affecting most of the parts that are affected in this particular outbreak is in Lusaka, and those are densely populated areas situated in Lusaka. Of course, cholera is in about almost the whole country. It's in about, I think, 6 provinces out of 10 provinces of Zambia. But all these 6 provinces have got this cholera outbreak. But Lusaka is the worst hit, and even most deaths are coming from Lusaka.
Now, Arthur, the one thing that we've understood is that the government has made a decision to delay the reopening of schools by 3 weeks, and this has recently been announced. What factors influence this decision, and how is it being received by the public and educational institutions?
Yes, indeed, the government has come in and through different ministries, Ministry of Health, Ministry of Education, and other concerned entities in government, including the Office of the Vice President, which heads the Disaster Management and Mitigation Unit, and agreed that the schools, that is from primary, from early childhood education, primary through to secondary school, all of them remain closed for a period of 3 weeks. Initially, they were supposed to open this coming Monday on the 8th of January, but it has been since moved to the 29th of January because of this particular outbreak. And of course, people on the ground, others are saying that, we're already ready for us to go ahead. But of course, they are acknowledging, even as them, that cholera outbreak, this particular cholera outbreak is quite severe and may affect their children. So people on the ground, most people on the ground have accepted this, and most of them are even joining in spreading the messages of cholera around the country using social media and just other platforms. So the people on the ground have received this, of course, with both hands, and of course they have agreed because they are seeing the number of people that are dying from this particular disease on a daily basis. So people have agreed to a particular extension of schools reopening.
Now, beyond the school closures, what are the preventative measures has a government implemented to contain the spread of cholera? Are there restrictions on public gatherings, enhanced hygiene measures, or other interventions that have been put in place?
So the government has been up and about and very active in this particular instance, and they are going around telling people just to maintain, a good hygiene around themselves. The food that they eat, they should make sure that it is clean. If it has to be boiled, let it be boiled. If it has to be washed, let it be washed. So the Ministry of Health, in collaboration with other ministries, are going around, sensitizing people on the dangers of cholera and all those things. And they are fumigating even areas that are worst hit with cholera. And of course, other measures that have been put in place is that they're calling on people in these particular areas where they draw water from shallow wells, and they draw water from boreholes that are close to petrol tins and all that, to desist from doing that and to bury those shallow wells. And they're also implementing the issue of going around and just distributing chlorine and also ORIs to people around in townships that are waste hit. So those are some of the measures that the government is putting in place. But of course, for the higher education, for them, they have been clear that the higher education, such as colleges and universities, they will go ahead, but they are just encouraging them to ensure that they maintain a proper and good hygiene each and every time. Every time one is from using, the toilet, they have to wash hands. Every time one gets home, they have to also look into the issue of washing their hands and just maintaining that proper hygiene. So those are some of the measures that the government is putting in place. And of course, they are moving patients from these other small clinics and hospitals, are taking them to a stadium, which is in Lusaka, a Heroes Stadium, the biggest stadium that we have in the country, and that is where the new cholera center is being set up. And of course, people have started being moved to that particular area where there's enough space for them, even as they attend to them and all that, so that they can even stop the infection of even healthcare workers that are also at risk of this cholera disease.
Arthur, good to speak to you. Appreciate your time. That was Zambian journalist Arthur Davies, Sikopo, unpacking for us the cholera epidemic out in Zambia.